Next company will be Teladoc Health, and presenting will be Ed Percy.
No, it will be Lucia Osoro, Sales Operations Manager.
I'm sorry. So Lucia Osoro, thank you.
Thanks, everyone. Hello, everyone. My name is Lucia Osoro. I'm the EMEA Sales Operation Manager here for Teladoc Health. I'm based here in Barcelona in the Teladoc Health headquarters. And for today, I'm going to take a step back and think, let's put in perspective, let's say a patient named Jack who had a stroke. Obviously, Jack was transferred into the hospital in an ambulance, got his catheterization, and then his journey with a lot of team effort, caregivers, family, physicians, physiotherapists, etc. started. A lot of backward, forward consultations and hospital visits, and a lot of data that has come out of his disease or medical condition, right? But let's take a step back and think, what if while the time Jack was on the ambulance, he would have already an earlier diagnosis made by a physician? What if during the catheterization, for instance, there was a difficulty and a specialist from another hospital could have dialed into that session and help fixing that problem? What if Jack would have been accompanied by his family, he's using different apps and using his mobile device, and he'd been undergoing the treatment and been accompanied all the time by his relatives? What if Jack doesn't have to go into the hospital to be with his physician, have a consultation, and this physician could see all the image, data, information on his healthcare condition and his improvement? What if this data could have gone straight into the EHR system of the hospital and they could have changed his medication earlier in the time to improve or change his medication or adjust it, right? So it's for this reason that we at Teladoc designed the Solo virtual care solution, this cloud-based solution. It's not only an interface, but it's an ecosystem, right? Where we can connect our low acuity and our high acuity devices, from pads, devices designed to be in the OR, in the cardiac, in the surgery room, devices designed to be in different mobile devices that can be moved in the ambulance or anywhere. Well, different physicians can dial in, allowing multi-presence, with a solution able to manage the bookings of the appointments, to see the images, fully integrable with interoperable with any EHR system, HL7 system, and with the possibility to interact with apps and external peripherals, right? So then Jack could have been treated earlier in the ambulance. Jack could be also monitored 24/7, even if the physician is not the specialist or the neurologist is not at the hospital. Someone could be checking on him because he would have a way to communicate, right? Jack could have also be back home earlier or back to the local hospital rather than being far away from home. Everyone, his physicians, his GP, his neurologists, they could access his medical records. They could see the different imageries and tags, magnetic resonance, or any other test that Jack has to undergo, right? He could have started his rehabilitation and he could be using an app that could be integrated into this ecosystem. And all these peripherals that he could take home, like blood pressure, etc., could be connected to the system and be feeding in the information. So what we have today is Solo. It's a solution that it's been trusted by some of the world's leading healthcare organizations. We have, upon the name by Bloomberg, 100 best companies, We've been working with the top 10. We have experience in, you may have heard about Villa Beretta. We have an artificial limb project with them. We have also projects with Charité with sites that are out of the European Union. And our system is GDPR compliance, fully secured, and certified for use for medical purposes, right? And with this, I would like to wrap up on the benefits of virtual care and how it's driving value-based for the population, improving the quality of care, the convenience and the participation for in the case of providers, increasing the treatment of rates, speeding up the diagnosis, like the case of Jack, where he could have had been earlier diagnosed, treated, maybe in the ambulance, in decreasing the total cost of care, like having the visits, less visits to the hospital by using diagnosis tools and analyzing the data, or reducing the time to appointment, the waiting time, and the traveling times for the patients. And if you have any question, do not hesitate on reaching out to us. My name is Lucia Osoro, and as I said, I'm based here in Barcelona. Thanks for your time.